Hi, everyone. This is Sean with the MassSupport Network, and I'm here with your Massachusetts Weekly Public Health Report for Friday, October 30th, 2020. So let's get right into it. It's been the worst week around the country, and Massachusetts is seeing significant increases here. So we're going to start by looking at the number of people in the state who are under quarantine. These are suspected cases, people who have had exposure, but have not actually become confirmed cases. So last week we were here at 4,726 cases, and we've jumped up over 1,000 new people under quarantine. In terms of actual confirmed cases, last week we had 10,500 people under isolation confirmed with COVID, and this week it's jumped up about 3,000 additional people in isolation right now. And the news is not going to get much better from here, I'm afraid. Hospital usage, 40 additional people in hospitals this week. The ICU beds have dropped down by 4 people. However, some of that may be because another 11 people are intubated across the state, and I'm not sure if those intubation numbers count towards the ICU numbers or not. So if not, then that's where some of that's going. In terms of who's becoming infected right now, no real change in age demographics this week. The hospitalization number is up 1 year, but in general, it is holding steady here, which, given that there are more people being infected, means that it's just a broader range of everyone, unfortunately. Looking at contact tracing, yeah, it's going to become difficult for our contact tracers to keep up with increased cases. We saw slightly less case outreach in the last week than the week before. And of course, these indicators are about a week behind getting this data, so it may be even less this week. We'll see next week. However, we are holding steady on contact outreach, seeing the same percentage there, which is good, as we're obviously still, even if the percentage drops a little bit for the case outreach, we're still getting to more people just because the case numbers are going up, but even though we're getting to a smaller percentage there. But holding steady on contact is great because that means we can get to more people who've had exposure before they can expose anyone else. So looking at the state in terms of community spread, and again, this map works by looking at the daily incidence rate of the number of new cases per 100,000 people in a community over the last 2 weeks. But if there's fewer than 5 new cases in the community, it won't show up on the map regardless of how many cases that works out to be per 100,000. So this is where we were last week. And if you brace yourself here, this is where we are this week. A lot of reddening across the map there. So just many communities that were yellow or green before turning red, and many just showing up on the map red for the first time that were previously not reaching a recordable number. So it's huge. Our daily incidence rate jumped from 9.2 to 11.8. And that's rather a big jump there. Also, remember on this chart, the asterisks indicate where there is a long-term care facility, an institution of higher education, or a correctional facility with more than 10 confirmed cases that makes up more than 30% of the cases in that town. So you can see there are several on there, with a few more in southeastern Mass that weren't there last week. So that is worth knowing. In terms of how this works out in percent positivity, which is an important factor. It shows that if we're doing enough testing or not, and where things are, where percent positivity is high, it may mean there's a lot more cases that aren't being caught. Where it's low, we may be getting just about every case that's in the area. So this is where we were last week, 1.24. There was an error here last week where initially it was reported the percent positivity was a massive increase to 2.31. They've changed that number since then. It was only 1.24, which was still an increase over the week before, but not doubling like I thought previously. So here's how we shifted to this week. Significant increase there of 0.31, which is a big jump there in terms of percent positivity. But now you can also see here anything in the 3 darkest colors is scoring at or above the positivity average of the state. So you can see some areas, especially just north and south of Boston, along the New Hampshire border, and in the greater Springfield area are the places with the highest percent positivity. This is very important when you see percent positivity in areas that are also densely populated. When you see up here in some of these hill towns between Berkshire County and Franklin County, some of those may have a high percent positivity because in a very small community, you may not need to really test that much. You may be throwing out 20 tests and get 3 of them back positive, and that still means you could be getting most of the cases there. But in, say, Springfield, Chelsea, these more populous areas, if the percent positivity is going up, that's a sign that there is a lot more spread there than we're able to capture. Another way to look at percent positivity is here and shows that it may be actually slightly higher than we are able to see from the previous chart. So the darker blue line, the lower one, is the percent of all tests that are positive, percent of all PCR tests. It says molecular distinguished from things like antibody tests, which test after the fact. So we've had a couple spikes there, but on the whole, that's how they've been as we get to that average right now of 1.55. But that's the percent of all tests. The top one is the percent of tested individuals who are positive. And this is because there are some people who are getting tested multiple times, especially frontline workers in hospitals, in care facilities, or also college students, as we'll see on the next slide. These are people who are getting routine screening testing, and that's going to actually make the overall percent positivity seem lower, because that means that if you work in a long-term care facility, you get tested every week, and you're never positive. Well, that seems like things are lower, but it's still you being tested every time. Whereas each new individual, we can see a steady increase from mid-September to now, where 6.6 was the last recording. Now, of course, these are individual days reports, not averages, so they are more prone to spikes, but that has gone up significantly. And as I did mention, colleges, this is how our higher education testing is looking. Now, last week, there were 231 new cases. It's dropped down to 175, and testing has still stayed pretty level there with, it was 232,000 last week, 232,000 new tests last week, and this week, 222,000. So pretty comfortable in testing, and is noticeable decrease in new cases, which is great. And hopefully I'll continue to go on there. If colleges are able to bubble effectively, we should see tests drop a lot there, or cases drop a lot there. But again, colleges are part of communities, and even if students are completely contained within their campuses, there are still plenty of faculty and staff which have to go home every day, and there's still plenty of opportunities for spread into and out of colleges. All right, so let's end by just looking at how the daily averages across the state for new cases are looking. And this is how things have gone in October. And we've seen a significant uptick. At the beginning of the month, we were getting a little over 500 new cases per day on average. And it's really just been in the last 2 weeks that we have seen this uptick to where we are getting over 1,000 new cases per day. And that's leading us to where we are right now. Okay, so everyone have a good weekend and a safe Halloween. Here's one last thought. Normally, I try to go out on something a little positive or fun, but I saw a newspaper headline from the Chicago Tribune that just really encapsulated 2020 for me. If there's one sentence that could really kind of get everything going on in this year in one headline, this would be it. Rooster kills police officer in COVID-19 lockdown raid. Just, wow. That's so on brand for this year. Okay, so have a good weekend again, everyone. Happy Halloween. You can find more from the MassSupport Network on our website or on social media. And remember, wear your mask, wear a cloth mask as well as a Halloween mask. Wash your hands, and we'll be here if you need us. Stay safe.